Hikurangi is a small integrated rural community located just 16 kilometres north of Whangarei CBD. For this community assessment, we ventured out to Hikurangi to observe and interview locals in multiple pillars of the community. Using the McMurray and Clendon Community Approach Framework, we have collected and compiled relevant qualitative and quantitative data about this community through comprehensive research, interviews, and relative data. We will be looking at Phase 4, which involves researching different aspects of people, place, health patterns, and gatekeepers. To help us with our community assessment, we have interviewed Alex, a resident of Hikurangi and the chairman of the community board, Dot, the registered nurse from the local medical centre, Tracy, a local business owner, and Linda and Paulette from the Friendship House, all who have shared their views on Hikurangi and their experiences with the community. Using the Phase 4 framework, we will be identifying the strengths, weaknesses, opportunities, and threats within the Hikurangi community.
The Hikurangi community, according to Statistics New Zealand 2018, has an increasingly younger population with a local age median of 30.6 years and a Māori median age of 21 years. According to the National 2018 Census Statistics, Hikurangi has a current population of around 1,614 residents, which makes up 1.77% of Whangarei's total population, sitting at 90,960 residents. Over the summer months, the area experiences an increased tourist presence due to the history of the township, the surrounding beaches, and the coastlines, all easily accessible through to the Tutukaka coast. Hikurangi's gender demographic, according to Statistics New Zealand 2018, consists of 792 male residents, which makes up 49% of the local population, and 825 female residents, making up the other 51% of the Hikurangi population. Statistics New Zealand 2018. The population of Hikurangi is composed of two main ethnicities, Pākehā at 67.9% and Māori at 49.9%. According to the 2018 census, people were able to pick as many ethnicities as they chose to identify with. According to locals, the 2006 and 2013 census, the population has always had a higher than the national average of Māori in Hikurangi, although the dominant population in Hikurangi is still Pākehā. Statistics New Zealand 2018. Hikurangi consists of a diverse range of religions, with two local churches, a Catholic and a Mormon church, both easily accessible within walking distance of the township. According to the 2018 census, 55.1% of locals reported having no religion, whereas 32.1% reported being of Catholic faith. Upon assessing previous census reports, this has decreased compared to the 2006 census of 43.3% and the 2003 census of 48.3%. This finding shows that there has been a slight decline in the practice of religion over the last 15 years in Hikurangi. Statistics New Zealand 2018. With Hikurangi being such a small township, it was quite easy for the locals to identify whom they considered were community leaders. Hikurangi has appointed a regional councillor for the Hikurangi Coastal Ward, Anna Murphy, who has a strong community vision and a degree in environmental services, Murphy MD. Alex Smith was also identified as a local influence and community leader, although this received a mixed response from some locals within the community due to his vision of developing the community using a business-focused approach. An informal leader identified within the community is Betty Fife, who has been an influential, active member of the Hikurangi community for many years and is also the Vice Chairman of the Friendship House Board. Betty is a volunteer within the community, helping in areas such as the local library, education and environmental services. She was also awarded the 2012 Civic Honours Award for her outstanding contribution to the Hikurangi community. Whangarei District Council, 2012. Although the Hikurangi community is classed as a rural township, they have many facilities that the community can use, such as the local cafe, having free Wi-Fi for customers to use, and adequate cell phone service around the township. According to Bender ETAL 2020, having adequate access to the internet and phone services plays an important role in positive health outcomes and enables small communities to have contact with GP services, pharmacies, and daily living essentials. The local Friendship House also offers services to the community such as printing, laminating, emailing, and scanning for a low cost to visitors and locals. They also print a monthly bulletin informing locals and visitors of the events happening in the Hikurangi area and local attractions, such as the Historical Museum, the Miners' Rest Cafe, and the Homemade Bakery, plus a tour guide van that aids in social event trips, day trips around the region, and wine tours. The local bulletin also informs the community of how many fire service call-outs they have had in the last month, and according to the February 2021 bulletin, they had a total of 16 call-outs in January 2021, many of which were related to either fire events or motor vehicle accidents. The community also has access to weekly bus services that run once a week at a low cost of $3 each way into Whangare's township to help locals with access to healthcare food services such as Pack and Save or Countdown. The service is utilised by around 9 to 10 people a week with the potential to increase the bus service to twice weekly. These community support systems and networks are maintained and in place for all community members through the help of the local Friendship House. After talking to a local of Hikurangi, Hiker 2021, identifies that the township experiences gang-related issues such as drug running of methamphetamine, although it is hidden from outsiders and the township maintains its image of a quiet rural community. According to the New Zealand Police statistics, New Zealand Police 2020, which are released on the last working day of every month, Hikurangi experienced 8 acts of intent to cause injury, 1 report of sexual assault, 17 counts of unlawful breaking and entering, and 15 reports of theft-related offences, with 41 reports of criminal activity during the month of February 2021. Being such a small community, it is quite a high crime rate of 1.46 reported events per day over the month of February 2021. According to Cook and Allegria 2011, drug abuse and substance abuse affects individuals and communities negatively and ultimately results in substance use disorders in the community and higher suicide rates. Hikurangi's marriage statistics for Māori families currently sits at 29.2% for the Hikurangi area, whereas Whangarei statistics are 30.9%. That compared to families of Pākehā ethnicity with a statistical finding of 32.7% in the Hikurangi area and 48.8% in the rest of the Whangarei region, New Zealand Statistics 2018. The small community of Hikurangi is situated 16 kilometres north of Whangarei and is located centrally to other Whangarei suburbs, such as Whakapara, Opuawhanga, Whananaki, Kauri, Hukirinui and Ipunui, and also runs northwest of the Glenberville Forest. According to Massey University 2018, Hikurangi is ranked as 9 on the socio-economic deprivation scale, indicating that it is one of New Zealand's most deprived geographic locations. According to Stafford and Marmot 2003, people located and residing in lower socio-economic regions experience negative impacts on their health due to the lack of resources available to them, such as job opportunities, social support, health services, and recreational amenities. The township of Hikurangi at first glance seems like a quiet, reserved, and almost territorial community with a pretty aspect and a selling feature of a picturesque village. The small town of Hikurangi has few facilities available to them, such as the local Miners' Rest Cafe, which was easily identified as the hustle and bustle hub of the quaint town. It also has a local library run by volunteers throughout the week, a homemade bakery with fresh goods, and a few bric-a-brac shops. According to local residents, the town offers a once-a-week bus route to the township of Whangarei to help aid locals who have no access to out-of-town facilities, and the option of being able to do so at a small cost of $3. This service offers cheap, affordable transport to access healthcare, whether it be for doctor's appointments or needing to pop to town to get medication or food. This service allows basic necessities to be available to everyone in the community. Readily available services in the town centre are easily accessible by foot for those who live in the immediate vicinity, and only a short drive for those who live on the more rural outskirts of Hikurangi. According to Fitzgerald 2012, poor access to transport is only an issue where individuals cannot access services and goods within the immediate vicinity. And unfortunately, many rural New Zealand communities experience high rates of depopulation, which is linked to the loss of such services, recreational activities, and employment or education opportunities. According to Statistics New Zealand 2018, 61% of Hikurangi residents were in fact homeowners at the time of the 2018 census, and has a steady baseline ranging from 65.8% in 2006 to 56.4% in 2013. The weekly median rent for the Hikurangi area is $300 per week. Statistics New Zealand did not reveal whether or not this included utilities, such as water, power, or internet, like some property rentals provide in the weekly rental prices. Statistics New Zealand 2018. According to Krager and Higgins 2002, housing conditions have been linked to a vast list of health conditions, such as asthma and respiratory infections, and are higher in homes that do not have adequate heating, insulation, or there is dampness, creating the perfect breeding ground for harmful pathogens. According to the 2018 census report, 35.8% of homes in Hikurangi reported dampness in their homes, and another 21.6% of households reported mould findings larger than an A4 piece of paper, which was visible in the homes. Statistics New Zealand 2018. O'Neill 2000 backs this up by also indicating respiratory diseases in both younger and older populations were affected by the dampness and mould found in homes, and were also identified that households who also had smokers, unemployment, or pets contributed to the related health disparities due to poor housing conditions. According to Whangarei District Council 2021, Hikurangi homeowners pay on average $2,200 to $2,600 in rates based on the location of the property and the utilities connected, such as sewage waste and water supply or tank water. After speaking to a local about the natural resources available in the area, it was evident that there are not many readily available natural resources anymore. Although, back when the community was first developed, it was thriving from local timber mill processing, dairy factory and mining. As the Whangarei district grew, these were outsourced to other areas, leaving the town without its foundation resources, and development of other areas saw the urbanisation of Whangarei and more people relocating out of Hikurangi in search of better job opportunities and income for their families. The closure of the local dairy factory saw job losses across locals and depopulation of the Hikurangi area, thus also leading to further closures of the local bank, gas station and other amenities. Hikurangi currently has locally grown fruit and vegetables which are easily available to locals and is purchased by Hikurangi local herself, who owns Holy Health and sells the sourced fruit and vegetables from Hikurangi, supporting the local businesses.
Health patterns described by Gordon, 1994, as a functional list of health patterns to aid nurses in providing a comprehensive nursing assessment. This list includes 11 categories, creating a methodical and standardized approach to data collection. Health perception, health management, relationships, sexuality, reproduction, stress, and beliefs are all functional health patterns this presentation hopes to explore in regards to the Hikurangi area. The Hikurangi Medical Centre is the only permanent healthcare service provided in Hikurangi, consisting of one nurse and one doctor. Although it has been discovered many in the community prefer not to utilise this service. According to Alex Smits, Linda Van Stone and Paulette Crowther, 2021, the Hikurangi Medical Centre is viewed as an inadequate centre to receive medical attention, and all the interviewees admitted that none of them used the local GP service. Smits discovered through looking for a GP practice when he first moved to Hikurangi, many locals were reluctant to recommend the Hikurangi GP and advised Smits to enrol with a non-local practice in Kamo Whangarei. The consensus from interviewing locals saw that some residents of Hikurangi view the practice itself as inadequate and undesirable. The facility is an old, run-down residential house, and many of the locals would like to see the practice revamped to be more of a professional-looking and feeling GP practice. Although healthcare is not about the building they visit, many locals feel it makes the service being provided at a lower standard than most other GP practices in the wider area. This being said, the GP practice is still sought out by many long-term locals and some previous residents of Hikurangi who have since moved away but make the trip out to Hikurangi just to visit the doctor. Many patients have likely been seeing them since they were a kid, or at least for a number of years, and they have created a doctor-patient relationship where the patient trusts the local GP over any other doctor, due to the familiarity and the trust they have built over the years. Many residents also don't have the luxury of being able to pick and choose their healthcare provider, as access to other facilities may be difficult due to income or transport issues. Despite the interviewee's depiction of the facility, it has many important qualities. The Hikurangi Medical Centre has the lowest fees in Whangarei at only $18 per 30-minute appointment for an adult aged between 18 to 64 years old. This is also twice the length of the appointments provided in any Whangarei GP service with no extra charge. HealthPoint ND. According to Dawson 2021, a registered nurse from Hikurangi, many patients find comfort that the local doctor has been working in Hikurangi for decades, and the more relaxed environment and the longer appointments allows the healthcare team to get to know their patients and gives the team more time to engage with them. The result of this is many patients have a tight client-patient relationship with the doctor. According to Gordon and Bearson 2016, having an impaired doctor-patient relationship can result in undesired health outcomes. Considering when a patient feels unheard and disrespected, they are less likely to listen to advice from their GP. A good doctor-patient relationship allows the patient to feel comfortable, heard, and accurately understood by their GP. This relationship allows the doctor and patient to work together for a desired health outcome. Access to healthcare is limited in Hikurangi. Other than the medical centre, they have no other permanent services. Although the primary healthcare nurses visit Hikurangi with the mobile air clinic bus travelling to the community usually twice a year. Plunkett also holds a clinic in the community centre every Tuesday morning, and Kia ora Ngāti a Māori health provider holding a whānau ora clinic every Thursday at the Hikurangi Hall. Plunkett mainly provides health and development checks, antenatal classes, and offers assistance to parents by supporting and educating them at every stage of early childhood development. Plunkett, ND. Kia ora Ngāti team consists of nurses and one doctor who focus on childcare services, mental health services, and immunisations. The mobile ear clinic is funded by Northland DHB and provides treatment of ear infections, pre- and post-grommet checks, wax removal, and education to the children and youth of Hikurangi. Northland District Health Board, ND. These services are provided to the community at no cost to the patient. With these services visiting the Hikurangi community, they bring access to health services that some residents of Hikurangi may otherwise not utilise. In doing so, these public health organisations are working to break down the barriers of inaccessibility for low-income families and locals with lack of transport. Dawson 2021 explained that a major barrier in the healthcare of Hikurangi is the lack of access that the residents have to x-rays, dentists, hospital visits and their follow-up appointments. There is a lack of public transport to Whangarei in Hikurangi. As stated earlier, the public bus only runs one day a week. In today's age, it is extremely difficult to get healthcare appointments, and only having one day a week to attend these appointments becomes strenuous for the locals. The lack of transport and access to local healthcare can result in a detrimental outcome to some patients' health. To aid the residents who have lack of transport, a Kamo pharmacy delivered scripts to Hikurangi every second day for only a small charge. Dawson 2021 acknowledges this cost to be less than the price of fuel for the journey. This service has been an extremely helpful aid in providing healthcare to the low-income and elderly families, resulting in better health outcomes. Dawson 2021 believes that one thing that the local practice could do to improve health services in Hikurangi would be to technologically advance the practice. She explains that the technological changes in healthcare services has its advantages in faster communication between health services when sharing information. Technology in the medical field has provided more accessible and efficient care. Through technology, the healthcare field has seen an improvement in care, communication, and inpatient provider relationships, assisting in more efficient healthcare practices. Parrish et al. 2017. This could result in better follow-up procedures from other healthcare services for the Hikurangi residents. Dawson 2021 explains that Hikurangi Medical Centre is behind in a lot of technological advances, although they are endeavouring to change this. Dawson 2021, the registered nurse from the local practice, gave insight into the local social detriments of health. The local practice once observed influxes of chest infections, common colds, severe asthma and eczema, but since the introduction of the Healthy Homes Initiative, the frequency of these illnesses has lessened and the overall health of the community has improved. The mission of the Healthy Homes Initiative was to partner with other organisations to educate and curate comprehensive housing assessments and action plans with low-income families to provide them warm, dry and healthy housing. Ministry of Health ND. The houses in Hikurangi are old and worn down. With this comes many damp and mouldy homes. The 2018 census still recorded after the introduction of the Healthy Homes Initiative, 11.8% of Hikurangi's population live in homes where there is always mould over the size of an A4 piece of paper. This statistic compared to Whangarei is drastic. Only 5.6% of the population of Whangarei report to always having mould. 8.6% of dwellings have also reported to always be damp, and 3.9% of dwellings report that they have no source of heating in Hikurangi. Statistics NZ 2018. The registered nurse mentioned that overcrowding is another prominent problem in Hikurangi. Although IDNZ states that 31.1% of dwellings in Hikurangi house 2 occupants, there is still 14.6% of dwellings that house 4 occupants, and 9.1% of dwellings that house 6 or more occupants. Comparing the 9.1% of dwellings that house 6 or more occupants to that of the 4.6 in the Whangarei district, Hikurangi still deals with the issue of overcrowding. IDNZ 2018. In a paper presented to the Ministry of Social Policy, Gray 2001 states that overcrowding can be detrimental to health in 2 common ways. The stress that comes with overcrowded homes can lead to illness, and shared physical proximity contributes to the spread of communicable illnesses. Dawson 2021 has seen how overcrowding can be detrimental to the health of its occupants. The conditions of the dwellings and overcrowding is still a current threat to the overall health of the Hikurangi population. Dawson 2021 was very informative on what health concerns she regularly sees in the Hikurangi Medical Centre. She sees a lot of women who decline cervical screenings as the procedure is too invasive. Cervical cancer is one of the most prevalent cancers, which is why it is important to get a screening. Having a cervical screen every 3 years can reduce the risk of developing undetected cervical cancer by 90%. Family Planning, ND. This being the case, although no data was found, it could eventually create negative health outcomes for women who don't get screened. Every patient has the right to decline such health interventions, but the Hikurangi Medical Centre does try to educate their patients as much as they can to allow the patient to make an informed decision about the procedure. Another prevalent issue seen in the Hikurangi community is a group of parents that do not vaccinate their kids. This puts the children at risk of contracting contagious life-threatening diseases like meningococcal. According to Stuff 2019, an 8-year-old girl died in July of 2018 in Hikurangi after a meningococcal outbreak. The mother of the young girl had not realised the implications of not having her children vaccinated. Although after her death, the girl's parents became focused on being informed about children's vaccinations. They even raised $18,000 to allow families who didn't qualify for free immunisations to get their children vaccinated. Ministry of Health 2018 reported that 14.7% of the children from Hikurangi had parents who declined their children from being vaccinated. Dawson 2021 and Crowther 2021 admitted there was a large anti-vax group in Hikurangi. An influential member of the school board at the time was also against vaccinations, which some locals believe to have influenced some other anti-vax parents in the school community. Crowther 2021 was also very involved with the 2018 meningococcal vaccines through the Healthy Hikurangi Trust after the young girl died. She stated that after the close-knit community witnessed the death of one of their own tamariki, many parents were too frightened not to get their children vaccinated. In the 2017 Health and Independence Report, the Ministry of Health explains that social determinants of health include education, social support, income, connection, and housing. The Ministry of Health closely links the social determinants. For example, material hardship in adolescence can lead to poor education, then leading to low adult outcome, ultimately affecting housing conditions. These social determinants play a major role in the access to healthcare. But health outcomes can also play a major role in positive or negative social determinants. For example, if you are in bad health, this can affect being able to work, ultimately affecting the patient's income. Ministry of Health 2018. According to Statistics NZ 2018, the mean income for Hikurangi's residents was $25,200 annually compared to the mean income of $27,500 annually in the Whangarei district. According to Judge and Patterson 2001, income is a clear social determinant of health, as income more often than not provides obstacles in acquiring health care. Often it is low-income families or families in poverty who desperately need health care but cannot afford to go see their local GP. Having a low-income family means obtaining food, shelter, and warmth can sometimes be difficult. These are all contributing factors to good or bad health outcomes. The stress that low income brings can also be detrimental to a person's health and can lead to serious health complications. Low-income families and families in poverty often develop health-damaging behaviours like smoking, which inherently are developed often due to finding mechanisms to cope with the stress, although it is an income-exhausting behaviour. Statistics NZ 2018 identified that 27.2% of Hikurangi's residents are current smokers, although the number of regular smokers has dropped 6.6% since 2006, it is still a staggering number compared to the Whangarei's district population, who only has 16.4% of people who are currently smokers. These statistics back up the claims from Judge and Patterson 2001 that people with low incomes are more likely to participate in health-damaging behaviours like smoking.
The District Health Board 2016 DHB is the gatekeeper and is responsible for the provision of healthcare services within their districts. The Northland District Healthcare Board provides financial support to Hikurangi by aiming to reduce health inequalities which are pointed out in the New Zealand Healthcare Strategy, the Ministry of Health 2020. According to King 2000, the future goals of the Healthcare Strategy Plan is to promote and support primary health care, mainly focusing on population health within their communities and supporting the development of primary healthcare organisations. King further notes that the primary healthcare organisations both work in collaboration with Māori and Pacific service providers across New Zealand by promoting and educating the benefits of primary healthcare organisations. One of the healthcare's key strategy health initiatives is aimed at reducing health inequalities between groups and supporting communities who are disadvantaged by the socio-economic deprivation. King 2000. According to Stats New Zealand 2018, which were previously discussed, socio-economic disparities are still prevalent in Hikurangi as being low on the deprivation scale. In regards to health outcomes, it is also noted that Māori do have a lower life expectancy than non-Māori due to socio-economic factors. These include lower incomes, poorer housing, accessibility, employment, social and support factors, which are all contributing to poorer health outcomes. Ellison 2006. Another gatekeeper of the Hikurangi community is the Northland District Healthcare Board. This is an organisation that provides health and disability services for the people of Northland. A key responsibility of the Northland District Healthcare Board is working in collaboration with primary healthcare organisations and providing them with funding that they receive in the annual budget, which is distributed from the New Zealand Government. Northland Healthcare District Board 2021. According to the Northland District Healthcare Annual Report 2019, a total of $3.9 billion was allocated to 20 district healthcare boards across New Zealand. Of that $3.9 billion, $721 million was distributed to the Northland District Healthcare Board alone. Additionally, a further $70 million of the total $721 million was injected into primary healthcare services across New Zealand. An estimated 18.48% of the total allocated amount of the new 2019 budget was distributed to the Northland District Healthcare Services, and the remainder of that amount was injected into other sectors such as transport and housing, the Northland District Healthcare Board 2019. Mahi Tahi Haiora 2019 is the primary healthcare organisation that is appointed to the Northland region by the Northland District Healthcare Board. The primary healthcare organisation does take an holistic approach to people's well-being by supporting communities such as Hikurangi and working in coalition with the Ngāti Hene Trust, providing and promoting social and economic advancement of iwi, hapu and whānau. Mahi Tahi Haiora 2019. During an interview with Paulette and Linda, Treasurer and Secretary of the Friendship House, Welcome to Hikurangi, both explained future goals and aspirations the community had hoped for in regards to future developments and infrastructure. One of these initiatives is the community felt there was not enough activity for the youth of Hikurangi, Crowther and Vanstone 2021. According to Paulette and Linda 2021, the community addressed their concerns by holding meetings with members of the community, followed by a proposal to the Whangarei District Council on strategies on how to improve activities within the community and to attract tourists to Hikurangi. The community proposed to build cycling tracks from Hikurangi town to the Tutukaka coastline and a proposal to upgrade the Hikurangi skate park for the younger generation to enjoy. Alex Smith, a real estate agent, Hikurangi property owner and previous chairman of Hikurangi Business Association, stated during an interview the relationship between the Whangarei District Council gatekeepers had been improving over the past couple of years, building a stronger partnership and both seeing eye to eye for future developments of Hikurangi. According to Crowther 2021, the Friendship Charitable House Trust recently received $2,000 for allocated funding from the Community Organisation Grant Scheme, also known as COGS. Crowther 2021 further explained parts of these funds from COGS went towards things like wages for the contractors, Community Matters 2021. According to Crowther, receiving funding in smaller but frequent amounts as opposed to larger amounts is a lot easier to manage, as these funds can be used for more urgent matters as they arise. Future developments noted from the Whangarei District Council 2020 are priorities listed as transport and safety improvements, including building a junction with the state highway and implementing a pedestrian crossing at the retail core, the Whangarei District Council 2020. Alex Smith 2021 further notes during his interview that the relationship with the Whangarei District Council had been improving and over the past 2 years, and they'd both been working in coalition and building a stronger relationship, which he stated is key to being the future and the success of Hikurangi. Together with the council and community participation, a project plan was implemented called Hikurangi Placement Program, aimed at Hikurangi seeing a moderate amount of growth over the next 20 to 30 years. The 3 areas of focus in the program included focusing on Lake Waido, Hikurangi Village Centre and Hikurangi Sports Park, the Whangarei District Council. Following a meeting with Alex, it was apparent that he was passionate and determined to engage and build rapport with his community. Alex 2021 further pointed out during his interview his vision for the future developments of Hikurangi. A key initiative that he envisioned was building a sport and recreational activities, such as the gymnastics, as his daughter travels to Whangarei for her recreation sports, which has been noted as an issue for low-income families who access sport and recreational activities. Smith's 2021. Additionally, Alex discussed the most recent funding the Hikurangi community received from the Whangarei District Council, which was putting it towards a project called Revive Hikurangi. Alex also explained the Friendship Charitable Board was allocated $100,000 by the Whangarei District Council to improve infrastructure, ultimately giving the town a facelift, which included painted murals and installing artwork at the entrance of Hikurangi, capturing the culture and history of Hikurangi. Smith's 2021. Alex further states that funding was also distributed to upgrade the local skateboard park, Whangarei District Council 2021. Alex further asserted that without community participation, proposed future developments were near impossible, and that even though he drives these proposed developments by sharing his ideas and expertise, it is the community who makes the final decisions. Smits 2021.
To conclude, this assessment has demonstrated how people, places, health patterns and gatekeepers all have an impact on what makes a community. Using the qualitative and quantitative data collected using Phase 4 of the McMurray and Clendon framework, a community-based profile on Hikurangi was established. The profile identified many weaknesses affecting the Hikurangi community. Having one GP and restricted access to other medical fields and amenities was evident in the findings. This can result in worse health outcomes for the community. It was identified the community has the opportunity to grow and flourish with the cost of housings much lower than the national average in Hikurangi. This resulting in new home buyers shifting to the area and contributing to the community. This could result in the outcome of increased access to healthcare, which would come with the increased demand for it with a growing community. This had already begun when the Whangarei District Council began to see it as an up-and-coming town and supplemented more funding for Hikurangi. The biggest strength identified within the community is Hikurangi is a small, isolated region. With this comes the strength of Hikurangi being a tight-knit community. As seen in the profile, the community is there to support its own locals. After establishing the strengths and opportunities of urbanisation, it could also be recognised as a threat to the community. After establishing the strengths and opportunities of urbanisation, it could be recognised as a threat to the community. Increased population can cause air pollution, increased pressure on the water systems, and a higher demand for city-strong planning, requiring additional resources and extra funding. These environmental factors can contribute to a person's overall health and well-being in the long term. Furthermore, as an opportunity arising from these additional pressures is an increase in the job market, as additional resources and developments need to be kept up with the demands for an increased population.